I'm Jesse Jorgensen. I'm with Carolina Cardiology. I'm the medical director of the Cardiac Catheterization Laboratory and one of the lead physicians for the percutaneous valve program. TAVR stands for transcatheter aortic valve replacement, which means minimally invasive replacement of the aortic valve. The aortic valve is one of the four valves in the heart that connects the left ventricle, which is the main pumping chamber of the heart, with the aorta. This procedure is done for patients who have symptomatic severe aortic stenosis. Aortic stenosis is narrowing of the aortic valve, and the typical symptoms of aortic stenosis would be chest pain or shortness of breath. Often patients will develop congestive heart failure. It's something that can be diagnosed by your physician with a stethoscope. So it's a very simple thing to diagnose with physical exam, and it's evaluated further with echocardiography, which is ultrasound of the heart. The TAVR procedure is done in a room called a hybrid catheterization lab, OR. It's done with a surgeon and a cardiologist working together. It's usually done with a catheter in the groin in a similar fashion that we do a heart catheterization procedure or a stent procedure. The valve is made of a very thin metal tube with a tissue valve suspended inside, and it's expanded within the patient's own valve in the same way that we would put in a stent in the heart. The procedure takes several hours to do. It's done with the patient under general anesthesia. One of the benefits of this procedure is that the recovery afterwards is typically much faster than traditional open heart surgery with valve replacement done in that fashion. And so this procedure is done in patients who are felt to be too high risk in order to undergo traditional open heart surgery. So this procedure is done in patients who are symptomatic from the valve narrowing. And so the benefit seen afterwards is typically fairly immediate. There is a recovery period. There is a small incision that's made in the groin, but typically that recovery is fairly quick. Greenville Hospital System has a fairly unique collaboration between heart surgeons and cardiologists working as a team. We have a valve program that involves both the surgeon and the cardiologist. It actually has several cardiologists involved, the interventional cardiologist who actually implant the valve, and also an echocardiography specialist who helps during the procedure. And that collaboration has been very well advanced in our system, and that's a very important component of a successful TAVR program. So the TAVR procedure is something that's been done very routinely now in Europe and in Canada. It's been done in the United States for several years now as part of clinical trials. It was FDA approved in December of 2011 for commercial use, and so it's going to be relatively new. Patients who are good candidates to be considered for the minimally invasive valve replacement procedure are those who have severe symptomatic aortic stenosis who are too high risk for surgery. And so if you have a patient who you feel would benefit from aortic valve replacement but appears to be high risk from an operative standpoint, these are the patients who we would be happy to evaluate.